Good evening, everyone. Nau mai haere mai ki tēnei wānanga I purangi, care work, COVID and gender inequality. Ko Catherine Ravenswood ahau, he ahorangi tūhono ahau o te wānanga aronui o Tamaki Makaurau o Aotearoa. Tuatahi nā te kaupapa tātou I karanga, tētahi kaupapa o te mana orite mō ngā kaitiaki I te ao, e rere ana ngā tai o mihi kia koutou. E hea kei ngā tangata I tautoko I ahau, kia Tamara, ki Narisha hoki kaore I tua atu I a koe, hei whakahaere tēnei wānanga Zoom. Ki a ngā kai kōrero, he nui o koutou atawhai o koutou whakaro o tēnei whakapapa, ko koutou te puna o tēnei kōrero. E tika ana kia mihi atu kia koutou. A warm welcome to everyone joining our webinar, Care Work, COVID and Gender Inequality. We are joining the webinar from around the world. I am Catherine Ravenswood, an Associate Professor at AUT in New Zealand. I just welcomed you in Te Reo Māori, the Indigenous language of New Zealand. Firstly, I would like to acknowledge the shared understanding that brings us all together, that is founded on the outstanding work of millions of women who are caregivers around the world. Your work is immense and keeps our societies going. We thank you. There are many people I and my co-host, Dr. Fiona McDonald from RMIT University need to thank, more than we can name here. I would especially like to mention Tamara and Narisha, who worked in the background to get this Zoom webinar up and running. I'd also like to thank the New Zealand Work Research Institute and RMIT's Centre for People, Organisation and Work for their support. They have joined the Care Work Network to jointly sponsor this webinar. And thank you very much to our three speakers today. Without you, obviously, this webinar would not take place. We really appreciate the time you have taken across several time zones to share your knowledge and expertise with us. As this webinar is co-hosted by RMIT University in Melbourne, Australia, we would also like to acknowledge the people of the Eastern Kulin Nations on whose unceded lands RMIT stands. We respectfully acknowledge their ancestors and elders, past and present. So welcome everyone. Just before we get going, we have a few housekeeping notices for you. As this is a Zoom webinar, you may know if you've been to them before, the attendees aren't visible to the panel. Each of our speakers will have approximately 10 minutes to speak, and once they've all presented, we will have a question and answer session. We do need to finish within 90 minutes. If you have a question for any of the panel, please put your question into the Q&A function on Zoom. Fiona McDonald will then direct questions to the panelists during the question time. We do hope to get to all the questions, but of course, we are constrained by time. If you have any technical issues, such as the speakers are in poor light, it all looks good to me though so far, please use the chat function to let us know and we'll do our best to address the problem. So without further ado, I'd like to introduce our first speaker, Sharan Burrow, who's the General Secretary of the International Trade Union Confederation. Sharan is joining us from Brussels. The International Trade Union Confederation represents 200 million workers in 163 countries and territories with 332 national affiliates. Sharan was previously President of the Australian Council of Trade Unions from 2000 to 2010 and is a passionate advocate and campaigner for social justice, women's rights, the environment and labour law reforms, and she has led negotiations on major economic reforms and labour rights campaigns in her home country of Australia and globally. So welcome, Sharan. I'll hand over to you now.
Good evening, lovely to be with you. I nearly said sisters, but I actually got an email earlier saying there were some brothers on the call as well, so sisters and brothers. Indeed, it's lovely to be with you, and to our New Zealand comrades, let me say tēnā koutou, tēnā koutou, tēnā koutou katoa, with apologies for butchering the accent. In the context of care, this is an issue whose time has come. We've been campaigning around care for a decade or more, certainly in terms of equality. I see Natalie on the screen, Sally before her. We fought big battles to try and actually see that workers in care were respected as being the skilled workers that deserved equal treatment. But you know, apart from some victories we could celebrate along the way, we still have a very long way to go, and globally, an extraordinarily long way to go. Let me give you a picture of the labour market and the situation even before COVID-19. Very briefly, you've heard me say this before, many of you, but the global labour market's in trouble. It's in trouble in your own countries. But if you think that 60% of the global workforce is indeed working informally, you can understand the majority of those people are women. It's a sector of desperation, no rights, no minimum wages, no social protection, and of course, no secure work, no rule of law effectively. And even then, when you think, oh, that's a developing country issue, think again, look around your own cities and communities at the unemployed and the underemployed and what they do to struggle for a livelihood, but also look at the new and emerging platform businesses, the internet mediated businesses, of which care is actually at the mercy now of seeing the breaking down of secure work because of internet contracts. These businesses take no responsibility. Again, there's no guarantee except where you have statutory or nationally legislated minimum wages, and often no social protection, particularly outside of developed economies. So in that context, women work across both formal and informal, but in each category, they are in fact in care, in community services, which I associate with care. In fact, we say it's actually education, health, childcare, aged care, and community services, because in fact, this is about care. And we've seen a convergence of crisis that has made inequality where women dominate in these labour market sectors, even escalate even before COVID-19. So if you think inequality, the explosion of inequality with a hyper-globalised environment, the breakdown of the social contract, then care workers in that broad definition, predominantly women, were already becoming more unequal in terms of the labour market. If you actually then go to the climate emergency, again, convergence of crisis, increases inequality, loss of lives and livelihoods has been with us from frontline victims now for more than a decade, not always recognised, the bulk of them women, and many of them caught up in care, of course, unpaid care as well as paid care. So when you then look at that global crisis and the breakdown in trust, women have been the most trusting of people because they're prepared to give to their families, their communities, their neighbours. It's kind of, inherently in the DNA, because women bear the burden of care for their own families, and therefore it translates more easily. But if you think about those crises and the convergence of those crises with massive and escalating unemployment, in a breakdown in the global system, the lack of trust in democracy, then women who were the most supportive of government programs are even now less trusting of democracy, and young people in particular. So then COVID-19 marches along. What a year this has been. And, kudos to all of you for putting lives first, but at the same time fighting for advances in the social contract, as we call it, to look after workers who are in lockdown or affected by COVID-19, or indeed frontline workers in health and services. So this has exposed, of course, the very deep divide. It's shown now massive unemployment worldwide. In fact, you can't even track the impact of unemployment for women because they've fallen out of looking for jobs in too many economies. If you actually look at that informal economy, we have 1.6 billion people facing destitution because They look to survive every day on what they earn each day. And they have very little social protection. So it's not news to anybody why we're running a global social protection fund campaign for the poorest and most vulnerable. However, we need two things. We need, first of all, to repair the labour market wherever workers work. And for women, that's a predominant must. So last year, we already saw the breakdown over a number of years of the labour market. And last year at the ILO conference, a centenary conference, we negotiated a centenary declaration that said that all workers, irrespective of where they and how they are employed, must have a labour protection floor. It must have fundamental rights, of course, freedom of association, the right to collectively bargain, but the right to be free of discrimination or child and forced labour as well. We must have occupational health and safety, and one of our struggles is to get occupational health and safety to be part and parcel of the core labour standards. And that's actually fundamental for women and men in care, as well as it is, of course, in other sectors. We often think of occupational health and safety as being a construction issue or a transport issue or, you know, a frontline issue for, at the moment, meat workers and other factory settings. But actually, it's the frontline workers in care who have been at most at risk, risking their lives every day to save ours, and indeed risking those of their families. So occupational health and safety, but it must have a minimum living wage, an evidence-based living wage. In other words, what will it take under our traditional definition to raise a family with dignity? And of course, we fight minimum wages cases all around the world, and they are most prevalent for women in these sectors. Then it must have maximum hours of work. Now, that's a complex beast. Convention 1 is about working hours. The principles still hold, 8 hours or less, we would say, 8 hours work, rest, leisure, but the way in which we manage work, even for people like me and those of you managing staffs in this virtual lockdown, how do you manage the intensity of a day that's, if possible, even more bruising in a virtual world than it is in a physical world, when you know that there are people in your ranks who need to be supported by different time arrangements. So this is an incredibly complex thing, but we still must have a guarantee of maximum, and we would say minimum, hours of work. That must be married with social protection. If you don't have universal social protection and that floor of guaranteed rights and income, and for the informal sector, we extend, the ITUC extends that notion of a minimum living income, living wage to an income, because one way or other we have to make sure everybody has a minimum income. A little bit different to a basic income for everybody, because we would say if you're in work earning a decent wage, then while you'll need social protection, a basic income is not what you need, but those who do need it should have it. So minimum wage, minimum income translates for us as an equivalent. Then, of course, beyond that, we need to look to recovery and resilience. So we have a set of recovery and resilience principles. In the interest of time, I won't go through them, but I will focus on one area, and that is investment in jobs, 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 and jobs. And of course, as I said, social protection. But when we talk about investing in jobs, then of course we call for enabling green infrastructure to deal with the climate emergency and other areas. But that must include soft infrastructure. And we used to say that originally. Now we just say care, investment in care. Because if you take infrastructure and care, then you have an economic argument around participation, because they're both pretty equivalent. Care might actually nudge out infrastructure as the fastest medium-term multiplier of jobs. Women's participation is the fastest multiplier of jobs. And if you invest in care, you get both. You get women in good jobs, if we can clean them up and achieve equal pay and make sure all those conditions of safety and the other areas of the labour protection floor are there. But equally, we get the support for women to raise their participation in other sectors of the economy. So care, apart from its social implications, is in fact the fabric, if you like, of a decent society that will have a resilience going forward. So I would say to you, investing in care has to be at the centre of resilience, because within, who knows, just a few years, could be next year, could be 5 years, decade away, but we will see continuing climate emergencies, economic shocks, maybe even other pandemics as we destroy the planetary boundaries. And most people don't understand that the impact and the demand on care that your members are facing is actually not just because of some mystery virus, it's actually because of health environments we can't manage in a global sense, because the planetary boundaries are breaking down, the convergence of disease across flora and fauna is actually increasing, and who knows what's ahead of us. So what we can do as a trade union movement is demand a recovery. That's a very different world from the one we left, because we do not want to rebuild that world. It has to have a much more equal and interdependent but resilient model that sets every country and every worker in every country up for a secure future. So labour protection floor, the social universal social guarantee, a transformative agenda for women, which includes care and just transitions for for climate and for technology, and of course investment in our vital public services, including and beyond, to ensure that care brings us jobs, jobs and jobs, but community sustainability, and indeed a fabric of humanity. That means we can care about each other, but we can also indeed start to rebuild trust in our democracies. Kia ora.
Thank you very much, Sharan, for bringing your global insights, and also for reminding us that we should be looking forward as well, not mired only in the present, and really highlighting that care is that fabric of society, as you said, and that investment in care is investment in women and society, and of course our recovery and resilience. So from Sharan, I'd now like to introduce our second speaker. Kirsty McCully is a director at E2 Union in New Zealand, and E2 is New Zealand's largest private sector union with members in the aged care, home support, disability support, health and community sectors, as well as aviation, food and manufacturing, communications and engineering and extractives. Kirsty has also worked in the union movement, both in Australia as the National Campaigns Manager for United Voice and globally as the Director of the Unicare sector for UNI Global Union based in Switzerland. So thank you, Kirsty, for joining us this evening.
Well, thank you for having me, and kia ora koutou, everyone. Thank you for such a good introduction to all of the different industries that E2 covers. Firstly, I just wanted to acknowledge the shared project of unions and progressives worldwide, including progressive academics, before and during COVID-19, to share our ideas, to collaborate and to strategize together, and to come up with solutions that can deliver gender equality and decent lives for working women in the care sector everywhere. I always feel like we gain immensely when we learn from those who went before us, but I also find it incredibly inspiring, as I'm sure you all do, to hear the stories of women organising for change around the globe. So I guess I wanted to say a little bit about the position of care workers here in Aotearoa, and then a little about what we've seen for care workers during COVID, and finally some of the strategies to build the power and the leadership that we need beyond COVID. So many of you will know that women in New Zealand won the right to vote first in the world in 1893, but it doesn't necessarily mean that women workers have fared better in our country than anywhere else. We know that what the world could look like, I think, with proper investment in care jobs and with proper respect and recognition for the women who deliver it. However, I think women in care work in New Zealand, as in most places, have never had the job security, the regular hours and consistent entitlements of their mostly male, mostly white counterparts, and the precariousness that we know as a feature of contemporary working class life has been a constant for women here, and as it has been worldwide, and as Sharan talked about. So we also know that women have been without access to the same social safety nets, or that stability for women has often been tied to a partner or a family. The growth of insecure work is definitely emblematic of that broader trend, I think, towards the shifting of risk and cost away from employers and to workers. And I think here, as everywhere, we've felt the clawing back of many of the concessions of the post-war boom. And in New Zealand, that's been in an ongoing way with the creeping privatisation and risk shift involved in the health sector and in care delivery. And, you know, just here in New Zealand, as they are worldwide, home care workers are forced to drive their own cars, use their own phones, coordinate their own work, do their own admin to make sure they get enough work, and they're paid minimally for the non-client time that they spend in their jobs. So that minimisation of labour costs and the extraction of profit from publicly funded contracts is a really strong driver here in New Zealand too. One thing I do think it's important to note around COVID-19 is the intersections of class and race and gender. When we talk about the care sector, obviously we've seen some overall improvements for women in the care sector here, and I can talk a little bit about that in a moment. But we've also seen a really high degree of insecurity for Wahine Māori and Pacifica and migrant women. And that's really clear when you look at the statistics. More than 70% of part-time workers in New Zealand are women. And in the wake of COVID-19, just as we've seen, job losses have primarily impacted on women here and around the world. And one of the challenges that I think we all face is to ensure that not only are the hard fought for rights that we have are not undermined, creating new forms of insecurity in addition to the ones that we've possibly all grown accustomed to. But we must pay particular attention to the situation of those more marginalised who make up a large part of the care sector and a large part of our care sector workforce here in New Zealand. One thing I've noticed is economists starting to talk about the K-shaped recovery, with those on higher incomes coming out of COVID even stronger, and those on low and insecure incomes really on the downward axis and struggling badly. So just in terms of the care sector in New Zealand, it is a permanently open shop environment in US union terminology. So we're always battling to maintain our union membership, and care sector turnover is high, workforce turnover is high as it is worldwide. But in an effort to create jobs with career pathways and decent incomes, ETU and other unions have campaigned and taken strategic legal action alongside fantastic member leaders like Christine Bartlett, who's in the background there, to win pay equity across the care and support workforce. And that picture is actually of a group of women with Christine as they all achieved an immediate $8 an hour increase as a result of that historic win, which was the biggest pay rise for those workers in New Zealand history. So it's fair to say that equal pay improved the lives and the income of more than 60,000 predominantly women workers across New Zealand. And we've also collaborated with unions like the PSA to win recognition for travel between clients for home and community support workers, and to make sure that that is considered paid work time, and to win permanent hours for care workers. But there really are still challenges on these fronts, which legal solutions didn't necessarily anticipate. So employers still seek a workforce that they can control and make flexible in the interests of maximising their profit, and as profit creeps into that sector. So in New Zealand during COVID-19, we were pretty lucky in the worldwide context, and I know a lot of people looked at Jacinda Ardern and wanted to have swap their prime ministers out and presidents out, but we're keeping her. But the country was without community transmission for over 100 days before the recent resurgence, which we've seen one cluster of around 200 cases over the past few weeks. But government advice and policy and media for essential workers really brought attention to care workers during the first round of COVID. I like to call it COVID round one. But frontline workers were suddenly visible to the population here in a different way. But support workers who were driving to their clients day to day were sometimes stopped and challenged by police, even though they were considered to be essential workers. They weren't always understood as such. And they were sometimes challenged at supermarkets when they tried to use priority queues to do shopping for their clients and so on. And in some cases, aged care workers were blamed, as they have been worldwide, for COVID transmission, despite it being very clear early on that the conditions were stacked against them in terms of being able to keep themselves and their residents safe. So I think the historical undervaluing and lack of understanding of care and support was clear in many of the struggles that care workers faced, like the struggle to gain access to PPE. Community workers identified really early on that they should be using masks as an absolute minimum, and gloves and other PPE, even when their clients had no symptoms of COVID-19 or no close contacts. But and of course the national guidelines, and the Prime Minister was talking to people about needing to protect their loved ones from COVID-19. But support workers weren't necessarily given the protections that they needed, and they were travelling between clients, sometimes 10, 20 clients a day. In the absence of managerial action, support workers were doing their own client screening checks, coordinating with support workers to ensure that they were safe on the job. And for weeks, the many other essential workers like the police had better protection than support workers, despite the close personal contact and bodily fluids that support workers deal with every hour of every day. And that's something that's resurfaced in COVID round two. We're still struggling to ensure that there'll be proper PPE for the long term for support workers. So despite the challenges, the pandemic and the lockdown has definitely created some organising opportunities for workers, and they've definitely taken the opportunity to front the media and social media to highlight some of the situations that they've been faced with. And the media has paid attention for once, as I'm sure everywhere else. There are some stories getting out there into the public sphere around the essential work that care workers do. And of course, for us as unions, the need to organise without physical contact and in the context of generally increased use of the internet meant a lot more connection nationally, but also globally, with support workers and with care workers everywhere. So we were lucky to be able to connect with care workers all around the world, from Australia, from Spain, from Switzerland, from Ireland. And we worked together with our global union federation, Uni Global, to create a set of demands and build some coordinated actions around the world, which really made care workers feel connected in a different way. So COVID, I think, in terms of our organising, also gave us the chance to do some of the things we've always wanted to do. Often we struggle to turn out members to face-to-face union meetings and struggle to get in touch with those who weren't already union members. But COVID's resulted in members being ready and willing to meet online. And we've had literally hundreds of home support meetings and care worker meetings online, with members turning up night after night to hear the updates, to share stories, and then to talk about how they coordinate and organise together around the issues that they care about. So as much as possible, we've used the opportunity to try and set up our delegate and workplace structures, and we've really learned that there's nothing more powerful than delegates from around the country meeting their management teams on Zoom to raise issues directly, and that's really empowering for our members, and it's pretty cool to watch. So I think we took more action than ever before and felt connected and united across the globe in different ways as a care workforce. We definitely took the chance to highlight a sector in crisis and a broken system. And we've tried to use responsive actions to focus on and highlight the kind of reforms that we need. But the challenge, I think, now is to learn from our organising during COVID, develop the connections and campaigns further so that we can create the kinds of powerful actions which generate real change. We all know that the care sector is still the least funded part of our health system, home and community support in particular. But we know the needs of our elderly and our vulnerable increase every year. So for us, the work is still piecemeal, insecure, does not have decent hours, and the workforce still has to contribute to doing to the cost of doing their jobs. So we are launching that agenda to call for more investment and to fix the systems that aren't serving our elders or our vulnerable or our workforce. So aged care still has appalling staffing ratios, and it's easy to see why those facilities have become, you know, COVID clusters all around the world through no fault of the workers. In a New Zealand context, we've got an election around the corner, and so from a whole of union perspective and probably whole of movement perspective, we've been trying to build platforms for union voice where we can link the principles of a good recovery to the expectations that we have of employers and of government. And we launched our own campaign, election campaign called Rebuild, which is exactly what Sharan was talking about, rebuilding but not rebuilding society the way it was. So I think that for us, this is our chance to influence what happens next and to take the call for change into new areas of campaigning. And certainly for some of our members, like in the aviation sector or some parts of the manufacturing sector, the line between employed and unemployed is really thinner than ever. But it does provide us with an opportunity to influence the shape of the social safety net and potentially to address some historic inequalities and articulate the role of an active state and of unions within that. So critically, I think we need to demand respect for the voice and the experiences of the workforce. I think it's a high-risk moment for New Zealand, the New Zealand government and for governments worldwide not to be ensuring that workers have proper health and safety standards and training in how to use their personal protective equipment. And acknowledging worker voice, I think, is about acknowledging the vantage point of workers as valuable. And I think governments really need to know and understand what's happening in their, within those workers' roles and in the community, because when they don't hear, poor decisions get made. So we surveyed our care and support members during COVID, and what they wanted more than anything was for their voice and experience to be listened to. 85% of those we surveyed said they felt like they had previously been ignored when it came to workplace decisions which impacted on their lives and the lives of their clients, and that's not good enough. So the pathway between the world as it is and the world as it should be, I think, starts with workers having a say. And that, I think, links to winning safe work and winning influence with those who can make the decisions about the way our sector is coordinated and funded. So if we can build our workplace leaders and workplace action, I think we can apply pressure to governments in a way that drives change. And finally, both Catherine and Sharan have referenced the social safety nets which work for women. So the description of modern day work as a New Zealand braided river, for those of you that haven't seen a New Zealand braided river, it's not a single channel. It looks like a kind of a plait with different bits of different channels moving in and out with interweaving streams. It's an image that I've always found compelling, and I think it necessitates a different kind of thinking about the supports that workers need in a different kind of labour market in a different kind of insecure world. So we need to push for the things that women need. So childcare, sick leave, carers leave, the social safety net to be improved, domestic violence leave, which I think we've helpfully been successful in winning in New Zealand, which is a real boon. Women have been so under pressure in this crisis, and I think we really need reforms which help drive gender equality. So in the contest of ideas, I guess what I'm saying is we have to carve out our own path, because we're the ones that can do it, and it has to be founded on the principles that we think matter, and shift the pre-COVID paradigms about what work matters in our society, and imagine what a world with good care for our elders and vulnerable looks like. I do think that these are the junctures when people can see with new eyes. I think the global financial crisis was one of those moments, and COVID provides another one. So people are questioning things, and our job is to organise and mobilise them, and also to continually reach beyond our own members. So that's all I wanted to say, and thank you for your time, and thanks to Catherine and Catherine Ravenswood and Fiona McDonald for organising this, and to all the fantastic people out there who continue to contest the space and to create the change that we need. Thank you.
Thank you very much, Kirsty. And I guess we're getting more and more inspiring as each of you speak, talking about not just the unequal position that women have, but the power and strength that women have as well, that are using that in order to be heard, hopefully, and continue to be heard, and create a better future for us. So last but definitely not least, I'd like to introduce our Natalie Lang, who joins us from Sydney in Australia. And she's the branch secretary of the Australian Services Union in New South Wales and ACT in the services branch. And the ASU is a growing activist union that has a proud history of successful workplace, industry and community campaigning. Natalie has worked with members in the water, transport, airlines, IT, private sector and social, community and disability services industries for over 14 years, including organising workers in the ASU's historic Equal Pay campaign for social, community and disability workers. During the COVID-19 global pandemic, Natalie's union has focused on ensuring safe work and continuity of service in the community and disability sector, and has grown the union's membership during this time. So thank you, Natalie. I will hand over to you now.
Thanks very much, Catherine, and thank you everybody for taking the time to dial in this evening or this morning, wherever it is that you may be. I'd like to start as well by acknowledging the traditional owners of the land on which we meet. I'm in Western Sydney, so I am on Darug land, and I pay my respects to elders past, present and emerging. Our members work in all community and disability services. So the kind of services that they deliver are places like disability support, National Disability Insurance Scheme, but also in areas like youth residential sector, child protection, family violence services, community development, homelessness services, and also mental health services, to name a few. Our members are absolutely on the front line generally, but especially during COVID. It's been great to see that there has been an increase in recognition of work in what was very much a hidden sector prior to COVID. I think often care work was overlooked and people were able to identify, well, what is a nurse and what is a teacher? But the idea of what is a community worker, people, struggled with a bit more. And during COVID, I think we've seen more and more recognition of this work as an industry and of the workers in the sector. I was asked recently if I felt optimistic or pessimistic about whether that recognition would lead to, better outcomes employment-wise for workers in the industry. I have to say I feel a bit optimistic and pessimistic. I mean, it's the optimism in the sense that it is great to see that recognition of the work, but a pessimism that what we know is when our members are at the fore, when care work is at the fore and people are able to really recognise it and see the incredible value and contribution that it makes to our society and to our economy, is always in a time of crisis. And that's when people, stand out the front of their house and clap, and that's fantastic. But when we're in good economic times and when there is money available for pay rises, then once again, we go back to being hidden. And if we ask for the pay rise right now while we're in a crisis, we're told, go away, don't be greedy, it's hard economic times, how could you ask for more? And so I think what's really fantastic about tonight is that we're coming together and we're sharing these experiences and these insights. It's great to be talking about what we think some of the drivers are for the lack of value of care work, and certainly we know that gender is the #1 driver of that lack of valuing of care work. But it will be great to share those insights and also to be talking about some ideas about what we want to see in the rebuild and how we can perhaps shift the discussion around what an economy needs, what a society needs, and the importance of, I think as Sharan put it, around that care infrastructure and the role that that plays in communities recovering from things like a global health pandemic. Our members deal with the terrible disease that is COVID, absolutely. So they are supporting people who are fearful of COVID, they're supporting people who may be COVID positive, they're supporting people in our community who are falling on very difficult, hard economic and social times as a result of lockdowns, as a result of infection, as a result of economic turndown. but they also deal with another incredible disease amongst our community, which is the disease of inequality. And I don't say that to trivialise how terrible COVID is, but certainly inequality cannot be disputed as a compounding factor of some of the worst impacts of COVID. We know that COVID has the worst impact on those who are also experiencing the worst impacts of inequality. It's the frail, it's the aged, it's people with disability, it's the homeless, it's those who experience the most disadvantaged every day. So members who work in the care sector, they work to combat both of these diseases, and we really need to recognise the importance of that work during a global health pandemic and beyond. The themes that I want to speak about today are about workers in the care industry in Australia. I'll try and stick to the 10 minutes and be quick. And so on that note, I think I should start at the very beginning, and I'd like to take you back to before the 1970s. Community and disability services in Australia were established by activists, and they established these services to meet community need. They set up shelters for women who were living with violence in abandoned homes. It wasn't governments who said, these are important services and we should have these and let's see who we can fund to deliver them. It was activists in the community who said, our community needs this, and they established the services and then fought for the funding. In the 1970s, we started to see government funding for these community services. And I think it's really important to know that history and to think about that history, because that's where we can get so much of the inspiration of, we don't just wait for governments to hand us things. We don't just wait for a government to fix the problems of funding, that we have an entire history in the care industry right around the world of activists saying, we demand better, we will meet community need, and establishing our services in the first place. Workers in the sector have had to fight for so many things. They've had to fight to establish their services. They've had to fight for the funding of their services. They've had to fight to be recognised as workers and not just volunteers. They've had to fight for industrial standards. They've had to fight for pay in the first place. They had to fight for equal pay, which is something that we won in 2012. And we saw pay increases of between 23 and 45% for community workers across the country. Now, unfortunately, the federal government are proposing to cut the funding for those pay increases and send workers back to where they were before 2012, back to that incredible gender pay divide. And so we do certainly have the battle lines drawn. The workforce in the community and disability sector are characteristically overwhelmingly women. It's a heavily female-dominated industry. We have a high prevalence of women from culturally and linguistically diverse backgrounds. Many have lived experience themselves and may have been users of community services before entering the workforce. They are often low paid, even with the equal pay increases that we've seen in Australia. They are insecurely employed, often with no job security, working multiple jobs and not being able to access the benefits of employment that workers in other industries enjoy, like long service leave and superannuation. And importantly, there are also skilled workers. We know that approximately 60% of the workforce hold tertiary qualifications. In Australia, the care industry is one of the fastest growing industries in our economy. Indeed, it's our federal government's own statistics that 28% of all new jobs that's going to be created in the Australian economy over the next 5 years are actually social assistance jobs. So these are care-related jobs. That should focus everyone's thinking, even if they can't agree with us on the social value of care work and the important skill value of care work. Surely they can agree with us that this is an important area of job creation in the economy. Also importantly, these are jobs in every single regional community. They're not restricted just to metropolitan areas or to central business districts. Wherever there are human beings, there are human services. And so really we need governments to look at how they should be supporting community services, how they should be supporting care jobs to make them really good, valuable jobs, because that's the best kind of stimulus that they can put into rebuilding our economy in every single regional community. Therefore, governments need to really recognise this as a priority and not a problem of people who are saying, please, sir, we want some more and we'd like additional funding. One of the biggest problems that we have is the lack of recognition and value of the care industry skill sets that we have. So this was one of the issues that we grappled with in our equal pay case, but it's also one of those issues that even though it's been proven and it's been accepted by a full bench of the Fair Work Commission and pay increases have been handed down, we continue to constantly come up against these arguments with funding bodies about is this skilled work and what are these skills? And nobody really wants to define these skills or put parameters around these skills because then they may have to pay for them. So again, a lack of recognition around care industry skills is one of the things that holds back the women who work in the industry from having the recognition that they deserve for decent work. The connection between government funding, pay and employment standards and also professional quality standards cannot be disputed. We've seen this time and time again where we have a lack of funding, we see low pay for workers, we see turnover of workforce, we see understaffing issues and we see poor quality outcomes. And we're talking about care to often our communities most vulnerable. We've also seen a massive shift in the last 5 to 10 years in Australia towards the marketisation of community and disability services. So we've moved on from the 1970s where services were formed by activists in the community and then funded by governments. And now governments are using the levers and the mechanisms available to them through funding to marketise the community services and the disability sector industries. This has been absolutely at the erosion of industrial standards and also the subsequent erosion of quality in many areas. Inclusion of for-profit corporations into the field of funded service delivery space has certainly sped up that slippery slide into workforce and community devastation. We know that corporations make decisions on the best interest of the corporation. It's decisions in the interest of maximising profits. It's not decisions in the interest of community need. And I'm not just saying that because I'm a crazy left-winger. That's just a coincidence. I'm saying that because it's a matter of law in Australia. The Corporations Act requires corporations to make decisions in the best interest of the corporation. And the best interest of the corporation will never be to end the inequality that drives the need of members of our community to access community services. It would never be to take away their customer base. And so having for-profit corporations coming into the field of government-funded service delivering community services has certainly sped up that erosion of working conditions. What are some of the features of marketisations that we've seen in Australia? Well, there's really 3 key approaches that have delivered that marketisation of community services. The first is the introduction and now heavy reliance on competitive tendering to determine which community services are in receipt of government funds. Now, the government says they have to do this because of, probity and contestability. It's absolute tripe, it's rubbish. We're talking about competing in a competitive tendering environment for services that have a set base cost. Workers in the community services industry are employed on an industry award. So there is an industry standard about what it costs to pay workers. And we're talking about care work, which we know is, very heavily human service reliant. So it's not like it's the building and the overheads that organisations can compete on. It's actually about the wages of workers and it's about the staffing levels and the levels of service that are delivered. So what we've seen with the introduction of competitive tendering is services having to compete on the basis of cost to win government funding contracts. This has seen a real breakdown in the collaboration between services. So what we had was lots of small services locally controlled who would work together with referral pathways to have a really healthy ecosystem of community services to support our most vulnerable. But in a competitive tendering environment where people aren't allowed to share because, that'd be terrible for probity, we've seen a real breakdown in that collaboration, which is so vital to the delivery of services and to the decent employment outcomes. We've also seen an erosion of employment standards that flows from competitive tendering. So we're seeing more and more short hour contracts, so people who hold a minimum hour contract that in no way reflects the amount of work that they do or need to do. We've seen a real loss of permanent jobs. So employees are carrying an employment contract that mirrors the duration of a funding contract. So if you have a funding contract for 3 years with the government, then the employees themselves will have an end date on their employment contract and not having that permanency of employment. We've seen massive underpayments across the industry, and that's regularly in the newspaper, so I won't labour that point, but except to say that that is absolutely driven by issues of competitive tendering. When they compete on cost, organisations are entering into funding contracts that they can no way meet by appropriately paying their workers. And we've also seen some really sneaky things like reclassifying workers. So where the award sets that work would be performed at a particular level, employers saying, well, I'm going to classify you at a lower level. I don't think you're that skilled. I don't think you do work to that higher capacity, simply as an excuse to pay workers lower. And the fact that our industrial instrument really doesn't describe the care work and care skills and care competencies well doesn't help. But again, it's that real global problem of having a significant difficulty in an industrial landscape of having instruments that do describe and capture those capabilities and those skills and recognise them properly. We've also seen an erosion of quality. So because of competitive tendering, organisations cutting back on all of the additional elements of decent work that they would otherwise provide so that they can reduce costs to win a contract. So we're not seeing provision of training like we used to. We're not seeing supervision, which is incredibly important in the provision of social and welfare work and that professional supervision reflective practice. We're seeing significant levels of understaffing, which means an increase in unmanageable workloads, which are poor outcomes for the worker and also poor outcomes for the vulnerable members of the community who rely on the service. We've also seen a loss of systemic advocacy because it's simply not funded. And that is a real problem for our democracy. And I totally take Sharon's point around people are losing confidence in democracy. Well, this is one of the major reasons why. Non-government organisations who are properly funded and independent and recognised and encouraged to use their voice about systemic advocacy, those are the elements that do give people confidence in democracy. And we're losing that and we're eroding that because of issues around competitive tendering and funding mechanisms. One of the other marketisation funding mechanisms that we're seeing at the moment is unit cost funding. So this is where a government department will look at the number of people who will be supported and the cost of that unit of support. So work is defined in units of output, which is an appalling way to look at human beings and human services, where we know human beings are unique and they have their own set of needs and they have their own set of complex indicators of disadvantage that need to be addressed. And to put them to a unit really doesn't recognise that diversity in people's experience and needs. Here, funders determine standards to minimise the unit cost. So instead of determining standards to have the best outcome, they go, well, if we set it at this standard, we can reduce the unit cost too. We've also seen the ability for employers to pool their funds for development purposes being drastically reduced. So because they don't have overall program funding, they don't have the funding to do things like innovation, community development, training and development of their workforce, community engagement and long-term planning. And again, we've seen the erosion of employment standards in this funding model, the unit cost funding model, where we've seen the limit of a real limitation on the number of senior positions because the unit price doesn't provide for there to be senior practitioners. So we just need everybody to be the lowest level community frontline worker only. So that lack of career progression is being completely decimated now across the industry. We also see job security being linked to the units of service that are being outputs. It's almost piecework in nature, and pay also being determined by the value of the units that you support. Oh, that's a high value unit of support, so therefore you'll be paid more. Oh, you work with a low value unit of support, so you'll be paid less. Again, it leads to the erosion of standards around things like less long-term investment in outcomes, only working with the unit that you're funded to work with, when we know that often the drivers of disadvantage that have people engaging with community services are more community-based or family-based, but here the service funding is just to work with that single unit. So the best outcomes, which would be gained by working with the broader family or community unit, is no longer there. We also see, again, less training, less supervision, less skilled workers being employed because they're more expensive, and again, that loss of systemic advocacy. And then the third marketisation model that we've seen is individualised funding. So it's a bit different to unit funding. Unit funding is per unit and provided directly to the NGO. Individualised funding is like what we have in the National Disability Insurance Scheme, where it's about client control. And I have to say, the NDIS is really important reform for the human rights of people with disability, and choice and control is absolutely paramount to achieving the human rights of people with disability. But we still need other areas of regulation to ensure that the system works. And really the government has kind of thrown their hands up in the air and said, oh no, it's only choice and control. And so they're not using those mechanisms that are available to government as a regulator and as a funder to build capacity across a scheme. So not all client groups, as we know, have the agency that's required or can exercise choice and control. So for example, homeless people really don't have the agency to be able to say, oh, I'll choose this homeless service and not that homeless service based on how they appeal to me. So it's not an appropriate model for many areas of people who rely on care industries to support them. We also see less outreach to engage the disengaged by the government. So less efforts by the government to say which members of our community are not engaged in our community and our care services, and how do we get them engaged. Again, we see no investment in an overall scheme and service system or capacity building or the workforce. So once again, we have an erosion of employment standards. We've had a huge rise in piecework, so people are paid for the hour of direct support that they receive only, and nothing else, nothing in between about travelling between different people with disabilities homes and putting that together as a single set of work. Nobody wants to pay for that incidental but core work like travel between clients, and so once again the worker ends up shouldering these costs. And we have seen workers who are shouldering so many costs that they're barely ahead at the end of a shift. There's a lack of clarity around who gives directions. Is it the client who gives directions, or is it the employer who gives directions? There's a case right now that I saw recently in the media where a client wanted a change of service provider, and the service provider says, in a marketised system,